Good afternoon. My name is Allison Drew. I am the program coordinator for the Iowa Regional Autism Assistance Program. Welcome to the Autism Basics Webinar Series featuring Dr. Jillian Reiher. This session is on treating dangerous behaviors. I would like to give a friendly reminder that certificates of attendance and foster parent training credit are available for the live sessions only. And now I am happy to introduce Dr. Reiher. Jillian Reiher fell in love with working with children with disabilities, both on the ice teaching ice skating and providing in-home behavior support after college. She earned her PhD in school psychology from Illinois State University and completed her pre-doctoral internship and postdoctoral fellowship at the Monroe Meyer Institute in Nebraska. During her postdoctoral fellowship, Jillian participated in the LEND training program. She has been a staff psychologist at the Center for Disabilities and Development since July of 2020. And in that role, Jillian sees children for evaluations and therapy. She's on two of the Center for Disabilities and Development autism diagnostic teams and has been trained in Project Impact. Jillian also spends a day per week in the Biobehavior Services Day Treatment Program. Dr. Reiher also serves as the psychology technical consultant for Iowa's Regional Autism Assistance Program. Outside of work, Jillian is the proud owner of an adorable and sassy bunny. As we go through the sessions today, questions can be typed in the Q&A box, and Dr. Reiher will respond to them at the end of the session as time allows. And now I will turn it over to Dr. Reiher.
Right. Thank you, Allison, and thank you all for joining us again today to talk about treating dangerous behavior. So we'll start with some just general thoughts on dangerous behavior. We'll talk about behavioral approaches to treatment focused on functions of behavior. We'll talk a little bit about parent-child interaction therapy or PCIT, and then we'll spend a little time talking about general safety strategies. So it's again just sharing my perspective and my biases and where I come from. I do, as Allison said, spend a week in a day per week in CDD's biobehavior day treatment clinic where we address dangerous behaviors from an applied behavior analytic perspective. So a lot of my thoughts and information on treating dangerous behavior are going to come from that realm. So what are dangerous behaviors? For when I think about dangerous behaviors, I'm thinking about something that causes harm to either the individual themselves or to others, and interferes in daily functioning in one or more settings. This can include physical aggression toward others, hitting, biting, kicking, scratching, self-injury like headbanging, hitting or biting themselves, destructive behavior like throwing or breaking things, or severe noncompliance, which can include things like elopement or folks who aren't able to follow directions for their own safety, like stop or come here in a situation where they need to do so. So this is an important topic for autism because dangerous behavior is often observed at substantially higher rates in children with autism than their typically developing peers. Many kids, autistic or not, are going to hit, kick, scream, throw things at some point in their lives, but it is more frequent for autistic children. Dangerous behavior, understandably, is also highly related to increased family stress. And if parents are stressed, it's a lot harder to parent effectively, which can then make dangerous behavior even more problematic. It also leads to issues with accessing treatments. There are just too many times that I've had families come in and say, well, we used to do speech therapy, but we had to stop because they were hitting the therapist or they were running off. And I'm not picking on speech. There are other therapies as well that kids have had to stop because they weren't able to participate in treatment safely. There also aren't a ton of treatment options. Last week we talked about how there are many, many, many different interventions for autism with varying levels of evidence base, but for treating dangerous behavior, really we're limited to behavior therapy, parent or caregiver training, and psychoactive medications. So there are some medications, and we talked a little bit about this last week, that have been or are commonly used for children with autism who demonstrate dangerous behavior. Risperidone, or I'm going to go with Abilify for that, can be used for irritability, aggression, and self-injurious behavior. But they do have side effects like weight gain that can be a real problem as well. Even one thing we see sometimes in our challenging behavior clinic is that kids' appetite increases on risperidone, and so they sometimes end up engaging in more aggressive behavior or self-injurious behavior because they're hungry and they're trying to get more food. Methylphenidate can also be effective for ADHD symptoms. Other medications like guanfacine, clonidine, or Strattera are also often used. And then fluoxetine might also be effective for, or other SSRIs can be effective for treating anxiety and or depression. There really isn't a lot of evidence for inside-oriented psychotherapy. So that's like talking to a child and saying, why are you doing this? Or, tell me more about what you're feeling, or those sorts of things. If we've gotten to the point where behavior is dangerous, it probably isn't going to be an effective intervention at that point. Or play therapy has not really been found to be helpful in reducing those dangerous behaviors in autistic children. So, my background in one of the stronger evidence-based approaches to treating dangerous behavior in autistic children, particularly, is the behavioral approaches focused on function. And behavior therapy can be provided by a clinician or teacher or something like that. And it can also be delivered by a caregiver, or what we call parent mediated or caregiver mediated. And this can be great because, first of all, caregivers are the experts on their child. I tell families, I know behavior well, but you know your child best. I know a lot about autism and a lot of different families of and their experiences with autism, but you know your experience best. This also increases the number of intervention hours that are available. Depending on the type of therapy, the therapist might only be able to meet with you 1 to a few hours a week, whereas parents live in the home and so can do that way more frequently. And it also allows for better generalization, or being able to um, transfer those skills into different settings. One thing we see a lot and we really work on in our day treatment clinic is that kids come in and end up doing a great job for us, which is wonderful. We love to see that, but we don't count it as a success until they're doing a great job for their parents. And ideally, then they're doing a great job for their parents at home because that's their real lives. I want to talk a little bit, when we're talking about function-based treatments, about the operant model of behavior. So when we're looking at a behavior, we think about the antecedent, or what happens before the behavior occurs. And then we're looking at the exact behavior and the consequence, what follows the response. So consequence in a behavioral model, I know in the kind of general society, it ends up meaning like a negative thing. You get a consequence if you do something wrong. For us in the behavior world, it's literally anything that happens afterward. Your child does their chore that they're supposed to. You say, I'm so proud of you, high five. That's a consequence in this model. Some of the ways that we can address challenging behavior is by focusing on the antecedent end, or what comes first. And that might include giving transition cues. So things like verbal prompts for time remaining. Hey, you've got 5 minutes left to play outside, and then we need to go in and eat dinner. Or giving verbal routines like, okay, remember, first today we're going to brush our teeth and get dressed and go to school. And then when we're done for the day, or when you're done with school, then we'll go to the park after. Visual supports. I'm a big fan of visual supports. I use them in my own life in the form of calendars and to-do lists all the time. But visual timers can also be good for kids who have a hard time conceptualizing time. You can use nonverbal cues like gestures to let a child know. This can be especially good if your child is easily overstimulated by auditory input. And so you might just kind of point to what they need to do instead of just reminding them over and over again. And you can also use other auditory cues like buzzers or music if that's something that helps your child. When we're thinking about, though, how to modify behaviors that are already happening, we want to think about the function, and function is the why, um, or what's it for. And generally, when we're thinking about functions, they fall into four main categories. Sensory or automatic is just it feels good or it makes things feel better. So, a lot of self-stimulatory behaviors are going to fall into this category. Hand flapping, spinning in circles. Most of the why between that is behind that is either it feels good or sometimes even like hand flapping can serve a self-regulatory function in terms of like, oh, I'm feeling stressed, but doing this helps me focus my body. Um, Generally, we don't intervene on these. I mean, we're not going to intervene on something like hand flapping. Every once in a while, we get an automatic dangerous behavior like hitting themselves or throwing things is honestly probably a more common one. Throwing things can just be fun sometimes. Um, and those are a little bit trickier to address, and we'll talk about that later. Um, Escape is wanting or needing out of a situation. So a lot of times we see this if somebody doesn't want to do the work or they feel uncomfortable in a situation, we might see them engage in a dangerous behavior to get out of it. Attention, wanting or needing somebody's attention in a situation. Tangible is wanting or needing something you don't have. The thing I always like to remind people about functions is none of these are good or bad. So a lot of times I hear people say like, oh, it's just for attention or it's just because of this or X, Y, and Z. We all engage in behaviors to get these things met at times. The difference is, are we using behaviors that are dangerous or are we using behaviors that are appropriate to the situation? So if I call my best friend because I want to talk about my day, I want attention. I'm engaging in that behavior for attention, and that's absolutely great. Same for escape. If I'm running away from a burning building, that's an appropriate behavior. However, running out of your classroom because somebody asked you to do math work is it more on the side of a dangerous behavior. Same for tangible. Kids want and need things all the time. It's not a problem that they want snacks or that they want toys or those sorts of things. It's only a problem if they are hurting themselves or others to get it. And then when we're thinking about the consequences, like I said, consequence for us is literally anything that happens after the behavior. And this chart is a lot. So I think ignoring the columns and looking at the row is probably the most helpful. Positive and negatives gets confusing even for people who've been in the field for a long time. But in general, reinforcement is anything that increases the frequency of, and this is a desirable behavior, but literally any behavior. Um, and punishment is anything that decreases the frequency of a behavior. This gets confusing and muddy for people because people do things like, or say things like, "Ugh, I told them to stop doing it. And, so I was punished, I punished them by telling them to stop doing it and sending to them to their room. And it's like, well, they continued to do it. So that behavior was not punished by that response. And same for reinforcement. If you have a really shy kid or a kid who doesn't like a lot of auditory input, and somebody is responding to their desired behaviors by being like, "Oh my gosh, great job," and making a huge deal out of it, that might actually do the opposite and punish their behavior. So we always want to think about what is motivating or punishing for that specific person that we're working with. When we're looking at assessing challenging behavior, we can start with an indirect assessment. This is usually where we start. We interview parents, caregivers. Sometimes it is the person with the dangerous behavior themselves. What's nice about this is it's less time consuming and expensive. Some things are hard to assess through direct observation, particularly things that occur in pretty limited settings or around times that are hard for other people to see. Like if the child only engages in the behavior during bedtime, it's going to be hard for a lot of clinicians to be able to directly observe that behavior. But it does depend on recollections, which can be messy. And the items can be open to interpretation or might not be understood by the reporter. And this happens sometimes where I'm talking to a family and I think we're on the same page. And then a little bit later on, I realize, oh, I was talking about aggression as hitting, kicking, scratching. And they were talking about aggression as screaming, yelling, and swearing. And both of those things are, or both of those categories are categories that we probably want to address, but different behaviors. A direct assessment is the gold standard, meaning that we do it when we can, but it is really hard to do in settings outside of a contained clinic like the one that we have at the CVD. And so, but the way to do it is what's called a functional analysis. So we have different conditions that we set up where we're manipulating both the antecedent and the consequence to see if we actually can reinforce that behavior and if that is what the behavior functions for. So in free play, kids get toys that they like, they get attention from a grown-up as much as they want or don't want. We're not asking them to do anything, we're not taking anything away. Um, and the goal with that is to see, do we still see challenging behaviors in that? Because if we do, that sometimes makes things a little bit more complicated. But that should be a condition where kids just feel happy and good. And then attention, we can either remove our intention entirely by, usually we still stay in the same room, but say like, hey, I've got to go over here and do some work. You can play with these toys over here. If the child engages in the behavior that we're worried about, we say, hey, don't do that, knock it off, or something like that, and go back to our work. And then the diverted attention would be more like, or excuse me, divided attention would be more like, this is more to handle like kids who don't like parents talking to each other or a parent talking to a sibling. So we say like, all right, mom and I are going to talk for a little bit. You keep playing with these toys, and then same procedure. Escape, we put some sort of demand in place, whether it's pick up these toys or do the schoolwork. If the child engages in the behavior that we're worried about, we say, okay, take a break. Um, for tangible, we take away the toy that seems to be the favorite or that the child is most interested in. We give them some toys that they don't hate but don't necessarily love, and we say, um, if you if they engage in the behavior that we're targeting, we say, okay, here you go, and we hand them back that preferred item for about 30 seconds. And we can get some really cool and helpful results from this. This one shows a pretty clear escape function. So the behaviors, looks like we were looking at destruction, aggression, and self-injurious behavior, the rate per minute. And by a pretty good margin, behaviors occurred at a much higher rate in an escape condition. We call this a lawful response, meaning that anytime we set up that condition, the child is much more likely to engage in the behavior that we're worried about. I can think of a recent kiddo we saw in the day treatment clinic who, anytime we removed a preferred toy, that child engaged in destruction. And what's fun about it is that sometimes we even see kids realize that they don't need to go as big to do it because we're reinforcing at any level. So for this particular child, it was destruction was one of the things we were looking at. And the child figured out that all he had to do was kind of like barely more than tap the wall with his fist, and then we would give him his stuff back. This is assessment, not treatment. But what's nice about it is that it does give us a targeted treatment plan. So for the child who was super motivated for preferred toys, we were able to teach, like we knew that that's what we needed to focus on, was teaching a way for that child to access the things they wanted without engaging in challenging behavior. So that means we can do shorter and more targeted treatments. We know what we need to do, and we can just do it. A functional analysis also pairs well with functional communication training, and in fact, that is what we did for the kiddo I'm thinking of. Particularly if there is a communication or functional communication deficit for kiddos who aren't fluent conversational speakers. FCT also has great evidence base. It is also watching it is just great because you have this moment where the child realizes, oh, I don't have to engage in these dangerous behaviors to get what I want. I can just use whatever the communication response is. For the child I'm thinking of, it was pressing a button on a speech generating device. For other kids, it's picture cards or using their voice. Doesn't matter as long as they're able to get that need met. So if we think it's an attention function, so treatment is always individualized based on the child. But in general, if we think it's an attention function, that means that we think the child is engaging in dangerous behavior um, to get attention, essentially, for whatever reason. So what we do is we minimize the attention for dangerous behavior. That doesn't mean that we fully ignore, especially when we're talking in the context of dangerous behavior. But it does mean that we don't usually use our voice as much to say what the kid should or should not do. We also give the expectations ahead of time or early. So, hey, if you do, as soon as you get this work done, I can start talking to you again. Or if you need my help, let me know. Um, we also end an activity if we see the dangerous behavior occur. And then we give a lot of attention for the behaviors that we like. So this happens all the time because it's normal that when things are going well, we don't give a lot of attention to it. Either we don't want to rock the boat or we're not noticing it because it's not a problem. But a lot of times we see kids get more attention when they do things that they shouldn't be doing than when they do things they do. So remember, if we think a behavior is happening for this reason, we want to make sure that they can still get that thing without engaging in challenging behavior. So we're giving them praises like, oh, I love how you are playing safely with your toys. You are using such kind words with your brother. You are um, doing a nice job of playing quietly, whatever the expectation is. If we think it is for a tangible function or because they want something that they don't have, if possible, we want them to do an appropriate behavior before getting access to the preferred item. So, for example, I work with kiddos sometimes and who will get into points where they're just really struggling to communicate what they want or need. And we've gotten to a point where they're crying, screaming. And so I will ask them to do something small that I know they know how to do, like give me a high five, touch your nose, whatever it is. Um, so that and then I will give them the thing that they want so that that's what it follows. We also can show them when the activity or item will be available. First, then can be some magic words for a lot of kids. So, first, we're going to do these three puzzles, and then you can play with the iPad. However, we do need to teach kids that sometimes things are not available or you have to wait for them, even when you're doing exactly what you're supposed to be doing, even if you ask in the nicest way possible. Sometimes it's still a no. Can't go swimming outdoors in the middle of Iowa winter. Can't have ice cream every meal of the day, even if you ask really nicely. But we definitely do want to teach communication to access those items or activities that kids want. If we think it's an escape function, that means that folks are engaging in dangerous behavior to avoid or escape a non-preferred or difficult task. And if that's the case, the first thing we want to do is make sure that the task is appropriate for them. And what I mean by that is that a lot of times kids are asked to do work that is appropriate for their age, but not necessarily for their developmental level or their skill level. So if a child doesn't know how to do addition and isn't fluent with that, multiplication is going to be really hard. If they don't know how to follow one-step direction, then it's unlikely that they're going to follow all of the classroom routines really well. But we can make sure that we're building in breaks ahead of time. Um, Again, this is one of those normal, natural responses is that we see kids get to the point where they're escalated and then possibly engaging in some of those dangerous behaviors. And then we say, you know what, just take a break. Um, I don't want them to have to get to that point before they take a break. So scheduling in breaks, especially if we're noticing patterns like at certain times of the day, or if we do a certain amount or type of work, then we need more frequent breaks. Work break and first then are also great. We can also, especially when we're just getting started working on an escape maintained behavior, allow the person to request a break at any time and honor it. We can teach that or help similar. Um, and at first, anytime they request it, we say, yep, you can take a break. Um, but eventually, just like with requesting preferred items and activities, sometimes you got to do things you don't want to do, even if it's hard. We can provide help for it, but we still have to do the things. We can also intersperse harder work with simpler work. So sometimes people are more willing to do even larger amounts of hard work if it's interspersed with things that are easy. Um, we also want to be careful about giving a timeout or removing a task for dangerous behavior if escape is the function, because if escape is the function, then that's what they wanted to happen. Timeout or removal can be okay still, but the key is that the kid has to go back to that exact same thing afterwards. So if a child starts throwing things during math class, um, it might be that for their safety or for the safety of others, they need to be pulled out of the room. But either that work should follow them, or when they come back to class, they should go back to that work. Again, assuming that it's an appropriate expectation for them. Um, but just so they learn that work does not go away. Also, should be pretty, breaks shouldn't be break to your favorite things most of the time. Um, because um, otherwise we end up with the situation of, is it a break? Are they doing this because they don't want to work? Or are they doing this because I would rather do iPad than work? So sometimes that can be helpful to see, like, what if we just give this person a break with nothing or with just things that are maybe kind of lower preferred for them. So again, if we think it's an automatic or sensory function, that means that they're engaging in the behavior to gain sensations that feel good or minimize feeling bad. And the first thing that we want to do is rule out medical issues. So sometimes we see kids do things like hit the side of their head. Well, it turns out they have an ear infection. Sometimes that's not the case at all, but if it's as simple as let's get you some antibiotics or let's get you appropriate treatment for your ear infection, that's what we want to do first. Also, of course, if the child is experiencing medical issues, we want to make sure that we're treating those. But then we also can think about more acceptable ways to access that sensory need. If the child is hitting themselves because they're looking for some of that deep pressure, can we consult with OT and talk about weighted blankets or um, toys that provide more like vibration or tactile input? If the child likes to rip up things that they shouldn't be ripping up, can we teach them these specific papers or items are things that you can rip? Anything outside of this, you cannot rip. Like I said, I love visual supports, so I use them a lot. For everybody, but especially when treating more dangerous behaviors, and they can be more complex, like a morning routine with multiple steps. It can also be as simple as just a first then. And you can modify these based on your child's needs or and skill level. Some children can handle a whole first morning routine and then whatever the fun thing is. Other folks might need it to be first you brush your teeth and then you can play with your toys for 2 minutes. And then we go to changing your clothes and then you can play with toys for 2 minutes. Again, highly individualized depending on the child and the person who is experiencing the dangerous behavior. As children gain reading skills, written counts as visual too. So, you can just write out the first and the then. Functional communication training, as we talked about earlier, is one of the strongest evidence-based supported interventions, probably period, but definitely for challenging behavior. And it is comprised of two main components, a differential reinforcement, so teaching an alternative to that challenging behavior that we will respond to. Recognizable communication bid literally can be anything that's not a dangerous behavior. It could be tapping somebody, it could be handing over a picture card, speech generating device, tapping a switch, pointing, anything. And then the other component is extinction, which means that if the child does engage, so we're going to set it up so that hopefully that communication is easy for them. But if they choose to engage in challenging behavior instead, we are still not going to give them what they want or need from that situation. We will wait and prompt them until they do the communication response. As soon as they do the communication response, even if there's been some challenging behavior before that, we give them what they want because we want them to understand that cause, a new cause and effect. And yeah, as I was saying, we think about for communication, does the person have a way to communicate? Um, what do we need to help them? Some kids, I think I said last week or the week before, we don't ever really give up on talking, but doesn't mean that we're always there yet for that person. And then we think about, is it available? Is it something that's going to be easily accessible for families, or for the person? So I don't know that we'll watch all of this. Or we may not get to watch any of it. Let's see. Hmm. That video is not working. I will check that link and make sure that it does work in general, but it is um, part of a playlist of videos that one of our behavioral psychologists and one of our speech therapists put together here on ways to address dangerous behaviors, including functional communication training. And it's great because it shows real families who have worked with us and the treatments that you would get if you came to a behavioral psychology appointment here. So this graph is a lovely example of what can happen over the course of treatment. So if we think about like initially we've identified the function of our behavior, um, looks like the behavior was probably escape. And based on that, there was a task for generalization. So at the beginning, we were seeing higher rates of challenging behavior, even once we started the functional communication training. That makes sense because, from the child's perspective, if they're engaging in dangerous behavior, it's working for them, by which I mean they're getting what something they want or need out of it. And so for them, we're teaching them essentially a new language, a new way of trying to get those skills or to get those things that they want and need. And so why would they? What they were doing was working for them. Um, but over time, when we no longer give them what they want for hurting themselves or others, and we do give them what they want for communication, we see that behavior drop significantly. We can also see it pop back up a little bit. This is also normal. Tends to be the point where families think, oh my gosh, this isn't working anymore. What it is the kid trying to see if those new rules still apply. I think of it like if you put your money in the vending machine and you press the button and nothing comes out. Most of us are not going to say, oh, well, I guess I don't get a snack today. Most of us are going to try to push the button again or push it harder. And depending upon how hungry or angry you are, you might start shaking the machine or kicking the machine. So we see those behaviors increase and then we see them decrease when they don't work. Then same vending machine example, you might leave the vending machine alone for a long time. But then eventually you might get hungry again and think like, oh, should I, I'm just gonna try it. And you try it again. And you might try a couple, button presses and things like that. And then when it doesn't work, that behavior is gonna stop. Um, so like I said, totally normal to see a treatment work for a bit and then see the behavior pop back up. But as long as you continue the treatment the way you have, it generally is going to go back down. Another form of assessment and treatment of challenging behavior that has become more popular over the last few years is something called skills-based treatment. Some ABA centers will use it, some schools use it. There are some differences with the more traditional function-based model and some similarities. Both do begin with an assessment of the behaviors of concern. But for the skills-based treatment, they're not separating out by potential functions or reinforcers. They're just looking for, can I turn off the behavior in some way? Both are going to teach some sort of communication response, but theirs tends to be more general, like my turn or my way, rather than a more specific, like toys or iPad, please. Both are going to focus on teaching additional skills once those dangerous behaviors are addressed. But there tends to be less tolerance for dangerous behavior as they expect the child to be happy, relaxed, and engaged to start treatment. There are some potential pros. Assessment can be quicker because they're not looking at those specific functions. Um, they say they're more trauma informed. I have mixed feelings about that. It may also lead to less extreme challenging behavior more quickly because if you're getting what you want right away, you probably don't need to go as big. But on the negative side, sometimes we can't get people to that happy, relaxed, and engaged state or maintain it for very long. Some kids are only okay with engaging in or not engaging in dangerous behavior when they get all snacks, including snacks that we probably don't want them to have or not to have as many of, or to all screens and or have 4 different iPads around them. And sometimes they're still not even then. And an issue that we've seen in our challenging behavior clinic is that there are children who centers will say, well, we couldn't get them to that HRE state, so um, we can't work with them, which again is not helpful in terms of them accessing services. And it might in the long term prolong dangerous behaviors because, like we talked about earlier, anything that's reinforced is likely to happen again in the future. So if the child learns that, oh, if I, um, slam my head against the wall, they give me my iPad, they're likely to do that again in the future. Another intervention for dangerous behaviors is, and for less dangerous behaviors as well, parent-child interaction therapy is great for a variety of like kids who aren't great at following directions or fight with siblings, take toys from siblings, those sorts of things. PCIT is an intervention for young children with disruptive behavior and their caregiver. So always, always, always involves a caregiver. It is 100% parent mediated. The therapist does not work with the child directly. They work with the caregiver by putting a bug in their ear and coaching them over a microphone. It was developed in the 1970s and was influenced by some earlier research on authoritative parenting, so providing both high levels of support and high expectations. And then also some previous research on things like social attention, giving direct instructions, praising for following through on things, timeout, and parent coaching. There is also an assessment component of PCIT, both direct, where the therapist watches the caregiver and child's interactions and codes them, and indirect with the parents report. Assessment measures do not evaluate function, but they do a pretty good job of saying, these are the specific behaviors that we're seeing both from the caregiver and the child. Evidence base is pretty strong for PCIT for treating young children, usually ages 2 to 7, with that externalizing behavior. So again, this can be more like on the tantrums or refusing to do the things they need to do and their caregivers. PCIT has two phrases. The first is child-directed interaction, and child-directed interaction involves the pride skills, which is praising what you like, reflecting what the child is saying, imitating what they're doing as long as it's safe and appropriate. And again, appropriate really means not engaging in dangerous behavior. Can be not a typical way of playing with the toy as long as it's still a safe way of playing with the toy. Describing what the child is doing. Oh, you're stacking the blocks. You're making a cool tower. And then enjoy, relax and have fun. If your child is engaging in a lot of dangerous behavior, it's likely that you're not getting a chance to have fun with them as often as you'd probably like to. And so this can be a nice way to build in some time where you can. And the selective attention piece is if the child does engage in any of those undesirable or um, dangerous behaviors, you don't pay attention to it. You make sure they're safe. You make sure that anybody else around them is safe, but you don't have to say, stop doing that or take things away from them. Once caregivers master that phase, they move into parent-directed interaction, where it starts to be the parent's way. So the first one is kind of child's way. You do not give any directions during child-directed interaction. Um, if you don't try to get them to do something you want to do, even if it's silly, like, oh, build like me, or, try to bring your car this way. Um, but then you start to in the parent-directed interactions, and they talk about different ways to give directions, as well as consistent follow-through. So we are going to make sure that you do this direction, and if you don't, we're going to do timeout. Hmm. This video is not working for me either, but that's one you can check out later and gives you some example of what PCIT can look like. PCIT again, has been found to be effective for children with autism as well as children without autism. The PRIDE skills are similar to child-led play skills used in developmental interventions and naturalistic developmental behavioral interventions. Um, it is also helpful because children with autism are at risk for those increased behavior problems. Parent-mediated approaches are definitely being incorporated more into autism interventions for all the reasons we talked about earlier. And PCIT is often available in areas without autism-specific services and areas with waiting lists for more autism-specific services like ABA therapy. So there have been some published trials looking at the effectiveness of PCIT for children with autism, generally showing better social functioning and decrease in disruptive behavior compared to children who were still on the wait list. Um, and um, The there is also some research to suggest that the parent-directed interaction phase might work better for children who have milder autism symptoms. It may not be as effective for children who have more significant communication impairments, or more significant restricted interest in repetitive behaviors. At that point, we might need to go more to those function-based approaches. We might need to do some modifications for a child with autism, including a visual schedule to show what the child can expect. Having a social narrative to say, all right, this is what we're going to do, and having visual labels. So, for example, if we're working on cleaning up toys, you might also have pictures on the front of the containers to show what goes where. You might also need more supportive prompting, especially if we suspect that the child doesn't actually understand the expectations. So for a pickup task, it might not just be like, okay, go pick up the blocks. It might be go pick up those blocks or go pick up the red ones, or even gently guiding their hand to say, okay, these are, this is what you're going to do when you're modeling it. We may decide that we want to avoid using timeout or the timeout chair for escape maintained behavior. And we might even just stop PCIT after the child-led play phase. And then if we are still seeing challenging behaviors, going more into some of those function-based treatments. It's always good to think about when we're looking at challenging behavior, there really is no one size fits all. So we want to think about, does this child need functional communication training because they don't actually have a safe way to get their wants or needs met? Do we need them to get more intensive ABA services to address skill difficulties that are leading to issues around those behaviors? Is it, they're having a hard time with toilet training because they don't understand or know what they're supposed to be doing? Should we be working more on a naturalistic developmental behavioral intervention where more of it is parent-led? Do they have enough understanding or ability to understand language to understand the directions? This is one I see pretty regularly where it's it's pretty common for us to just as we're speaking, as we're working with kids, to add gestures to our speech, or other kind of cues. And sometimes we don't realize how necessary those cues are for a child. So I've had families say, like, yeah, of course my child knows to follow the direction to open the door. But then it turns out if we say open the door and we don't point to the door, the child does not actually know what we're asking them to do. And or do they need social skills training because they're uncomfortable in situations because they're not fully understanding what other people are wanting or needing from them or what their behavior cues are? And then briefly, I want to talk about some safety strategies. This can include modifying your home in terms of installing extra locks or door or window chimes, gates, things like that. Um, think about what triggers your child, what might make them try to run from a situation where um, they feel unsafe, like, oh, yeah, this area is going to be, or this is going to be hard to go to this parade because the child really struggles with loud noises. Okay, so can we either figure out something like wearing noise canceling headphones or teach them to ask to leave the situation? You may also do wearable identifications of some ways or tracking devices, teaching safety skills, especially swimming. And then just knowing to be on high alert during warmer months or transition periods, outdoor gatherings, times when um, wandering or some of those other dangerous behaviors might be more likely to occur. What questions do people have?
What advice would you give to autism spectrum disorder kiddos with no stranger danger?
Mhm. Um, I think it depends on the verbal skills of the kiddo in question. Um, if the kiddo is at a point where we can start to teach some of the stranger danger, I would. There's some good, so like there's a curriculum called Circles that is expensive, but you can also find visuals to show some of the same sorts of things of teaching kids what behaviors are appropriate for people in certain circles of how well you know them. So you can hug mom or dad or grandma, but you don't hug the mailman. You can wave to the mailman though. And you can give a high five to your teacher, but we're probably not going to give your teacher a kiss. And so just explicitly teaching those appropriate behaviors as much as possible. If the child is not at a communication level where they can understand that, then it does tend to be more of that just supervision and motivating in whatever way possible when, it might be that you continually provide the cue, okay, stay with mom or stay with dad, um, if they are trying to dart off or go to strangers.
What do you do when a child instantly becomes um, or goes into fight or flight mode, meltdown, and then runs out into an unsafe place, such as running out of a grocery store into a parking lot?
hmm Yeah, so in the moment, you do whatever you have to do to keep them safe. That is number one every time. And we may have talked about this a little bit last week, but if we've gotten to a meltdown, the only things we can do is keep the child safe and keep everyone else around them safe. And so instead, if you know that there's a consistent trigger for your child, like grocery shopping, then what you might start with is have some sort of visual support or some sort of social narrative, depending on their language abilities, um, to let them know what's going to happen, what the expectations are. I would definitely have some sort of motivator if you got one that you can identify for being safe in those situations. And you may start really small. Depending on how tough it is for your kid, it might even be like you walk in the door of the grocery store. Okay, great job. Now we're going back to the car and you can have some fruit snacks or you can have play with a toy. Or we're going to go in, we're going to grab this one item and we're going to go through self-checkout or whatever is the fastest way out of here. Um, to gradually build up that tolerance. Also, it's always worth thinking about, are there sensory components that would make it harder for your child? So again, noise canceling headphones. Sometimes kids are bothered by fluorescent lights in some places. So do we wear sunglasses? But in general, that gradual exposure, setting them up for success and providing some cues, whether it's visual or whether they're at a point where you can just kind of talk them through it to let them know what's going to happen.
Are there any ASD specific apps that can provide kids or older teens with developmental issues safe online and to keep them safe online and on
Mhm.
social media?
That's a great question. I don't know of any ASD specific, but there is a website called the Smart Gen Society, and they go through and they rate apps and websites that are often used by children for safety level. Um, it's it's usually where I go if a parent says, I don't know if I should be letting my kid do X, Y, and Z. That's usually what I look at. Um, and I don't know if that totally answers your question, but it can give you some information about, like, for example, one of the things that I learned on their website is um, Minecraft actually has really great safety for kids. Roblox, not so much. Roblox you can do, but you have to really lock down the parental controls. I know one of my friends uses it, lets her 6-year-old play it, but she goes through and she's locked down like 90% at least of the games that are available on there. Um, so that's probably where I would go to figure out, are these safe places for them to be? And then they might even have some information on how to teach kids how to navigate social media safely, because it's one thing to lock it down and say, nope, we're just not doing that. But as your child grows into adolescence and adulthood, eventually we want adults to have the ability and rights to access the same information as everybody else. So we want to make sure that we teach them to do that safely.
There's a comment in the Q&A box about a medication called memantine. I'm not sure if I'm saying it correctly. I apologize. It's um, that they've had some success with their grandson using
Okay.
it.
Yeah, I'm not familiar with that one. Medical stuff is not my area of expertise. Allison and I were talking about this a little bit before today's webinar. But I always recommend checking in with your medical provider on that. And if you're not sure, or if you're, wanting some more information, looking at that Association for Science and Autism Treatment website that we talked about last week.
And do you have any advice for parents whose children they stim a lot and sometimes it can turn into self-harm, like maybe they're tapping really hard on their chins?
Yeah, those are hard. Um, Redirection tends to be one of the more successful things. So again, you can still tap, but you need to tap on the table or tap on a different body part that, has a little bit more cushion to it. Um, that tends to be the way that we have to go, is just teaching that and teaching that redirection. And it generally takes a long time because, again, for them, it's not a problem. It often doesn't feel like self-harm or hurting them. So yeah, that's probably my best advice for that. Or providing if you think there's other things they like, to providing something else that competes. Is there a fidget toy that they like that we can give them, or another activity to engage them in? So I don't decrease stimming just for the point of decreasing stimming, but if it is causing problems, it's okay to say, what else could we be doing at this time that this child might also still enjoy?
All right. Well, thank you all for joining us today. Thank you, Dr. Reiher. I will send out the recording links and the certificates of attendance later this afternoon. If for some reason you don't see it in your inbox, be sure to check your spam folder. Sometimes they end up there, but we will see you all next week for the session on school programming.